Hi, and thank you for coming to learn about your eye exam and macular degeneration, where our goal is to decrease vision loss from both dry and wet macular degeneration. So of course, we're going to recommend yearly eye exams. And if you have macular degeneration, depending on its stage, that may be more often. But what we really want to talk about today is extra testing that is not covered in your normal eye exam by OHIP. And actually, OHIP hasn't covered extra technology and new imaging in the last 30 to 40 years. So today we're going to talk about ultra-wide field imaging and OCTA. So let's start with ultra-wide field imaging, where that image gives us a big picture of the back of the eye at once. That allows us to make sure that things are healthy, to make sure that things aren't changing over time. And this is the best way to track progression. When I look into the eye using other tools, I'm either using a little rectangle of light or a circle of light to move that around the back of the eye to see, so you can see where the image is a better tool to monitor and to track. And what we're looking for is changes in dry macular degeneration where there's no bleeding, or changes where there's wet macular degeneration where there is bleeding. The other tool that we should be using on an annual basis at your yearly eye exams is OCTA. OCTA kind of has two parts, the OCT part, and then the A stands for angiography. When we look at the OCT, it's like taking an image of the back of the eye, spinning it on its side, and looking at the layers of the retina where we are looking for deposits or fluid within the retina. OCTA allows us to look at the vasculature. It pulls out all the blood vessels and all the different layers of the retina, again, allowing us to look for changes in macular degeneration that may be wet macular degeneration. And the faster we get you to those tests and treatments, the better the visual outcome is. So again, we want you to come for your routine eye exams, but for the best care, we are unfortunately looking at some tests that are not OHIP covered, ultra-wide field imaging and OCTA. And to be fully transparent, I am going to list the fees, the current fees involved in those tests in the description in this video. So we look forward to seeing you in the office for your eye exams, and we look forward to managing your macular degeneration.